Hi, and welcome to today's episode, episode number 7, How is Bowel Cancer Treated and Potential Recurrence of Bowel Cancer. Please remember, I am not a doctor, I have no medical training whatsoever. I am talking from the perspective of a bowel cancer patient. Please, if you think you need to, go seek professional help, talk to your doctor. So, treatment and care of people with bowel cancer is usually provided by a team of health professionals, both medical and allied health, and they're called a multidisciplinary team, or MDTs. The members of an MDT could include a GP, a colorectal surgeon, a gastroenterologist, a chemo-oncologist, a radiation oncologist, a cancer nurse, a dietitian, and other health professionals such as social workers, specialized pharmacists, and counselors, psychologists, and psychiatric people as well.
We're gonna kick some ass.
Cure some ass.
Treatment for bowel cancer depends on several different things. It depends on the stage of the cancer when it is discovered, so when you're diagnosed, the exact location within your bowel as well, plus also the severity of your symptoms, which we've talked about previously, and also your general level of health and fitness as well. There are several different ways that treatment can be delivered for bowel cancer. There are things that are called targeted therapy, hormone therapy, immunotherapy, chemotherapy, radiation therapy, and surgery as well. Surgery is the invasive option. They always try to go for the non-invasive options first to obviously provide the best quality of life during the treatment process.
Cure that ass.
So how do these treatments work? So targeted therapy. Targeted therapy refers to treatment with medication that are designed to specifically attack cancer cells without harming normal cells in your body.
The target area is only 2 meters wide.
One type of targeted therapy medication targets a protein that helps the tumors to form new blood vessels, so it restricts the blood flow. While there's another type of medicine that targets the protein that enables those cancer cells to grow. So it starves them off the food to grow, and it also starves them off a blood supply to hopefully shrink the tumor down before they grow into small or even large tumors.
I need the cure!
There's also hormone therapy. Hormone therapy uses a synthetic hormone to block the effect of the body's natural hormone. So obviously men have testosterone, women have estrogen, so there's specific medications designed to block those hormones from taking place. So the whole aim is to lower the amount of hormone that the tumor can receive, because if that tumor is feeding off that particular type of hormone, then obviously if you starve it off the food, it should in theory die off. This can help to reduce the size, but also more importantly, slow down the growth of the tumor, which can then give other options for treatment a chance to work as well. The treatment may be given as tablets, which you ingest, or as injections, depending on the type of cancer you have. Obviously, we're talking about bowel cancer. There's many different types of bowel cancer, so it's obviously best to speak to your medical team about that. For some cancers, you may need to have surgery to remove certain parts that are feeding towards that tumor, as well as doing the hormone therapy, but we'll get into surgery in a moment. But say, for example, there could be a cancer cell that's feeding off estrogen. So if you were to do the hormone therapy, for a lady, she might need to have her ovaries removed, because ovaries produce estrogen before she can actually go on those estrogen blockers. So that's important to know. Hormone therapy to treat cancer is not the same as hormone replacement therapy. HRT supplies the body with hormones that the body cannot produce naturally. What we want to try and do is block the cancer cells from receiving hormones. So we don't want that to happen.
Gotta cure all of them, right?
Another treatment method is immunotherapy. Immunotherapy involves treatment with medicines that boost the ability of the immune system to attack the cancer cells. So quite often, someone who has cancer, doesn't matter what kind of cancer it is, they do have a lower immune system, which is why the cancer cells can grow and spread so quickly. Immunotherapy can be used to treat some people with advanced bowel cancer, including cancer that cannot be removed using surgery, cancer that has come back after initial treatment, or cancer that has spread to the other parts of the body. So, you might have gone through all your treatment and everything else, you might have been clear for a little while and it's come back, but surgery might not be an option depending on where it's located. They'll attack it with the immune therapy medication, and hopefully that will be able to treat the problem.
What plan?
He's curing them.
So radiotherapy. Radiation therapy is also known as radiotherapy, and it uses radiation to destroy the cancer cells. Although radiation also damages normal cells, cancer cells are especially sensitive to its effects. So even though they're going to target, where that tumor is, unfortunately normal healthy cells will die off, but these healthy cells do regenerate a lot quicker than what the cancer cells do. And that's why radiation therapy is such an effective treatment option for bowel cancer. Radiotherapy can be used before surgery to shrink the tumor to make it easier to remove, after surgery to destroy any remaining cancer cells, as the only form of treatment depending on the situation, in combination with surgery and chemotherapy, but also to relieve symptoms of the tumor as well depending on the situation. Radiotherapy involves a total dose of radiation, which is divided into smaller doses or fractions. Typically, one fraction is given each day over several days until that total dose is reached. So for myself, I did radiotherapy. I did 25 sessions of radiation spread across 6 weeks. So some weeks I'd do 3 sessions, some weeks I'd do 4 sessions, one week I did 5 sessions, just so we could get to that 25 total, which the doctors obviously determined based on the stage of my cancer and the size of the tumor. It was 61 millimeters, so it did require quite a lot of radiation to be looked after. The 2 most common side effects of radiotherapy are skin problems, because obviously for the radiation to get to where the tumor is in your body, it's got to pass through those skin cells, through the muscles and tissues to where the tumor is. So, obviously the most common section of where the problem will be is where that radiation goes through. So for bowel cancer, through the abdominal area, through your hips, your pelvis area. So you might get some dry skin, itchiness, peeling, blistering, a burning sensation.
And it burns, 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 the ring of fire, the ring of fire.
Your skin might change colour, and there's all sorts of different things that might happen. For me personally, I did get a bit of blistering. I got a suntan on my bum. It looks a bit like a sultana, not to be horrible, but that's what it was. It was like I'd been sitting on a boiling hot chair in the middle of summer, and it lasted for quite a lot of months after I finished the therapy. Fatigue and tiredness. So the first couple of weeks I was okay, but for week 3, 4, 5, 6, and for a couple of months after that, I got tired very easily, and I'd have to have a sleep in the afternoon. I still occasionally have a sleep in the afternoon, and that's 2 years ago now. So the side effects can linger for quite some time. Other potential side effects depend on where the radiotherapy has been given to the body, and may include head or neck problems depending on what's happening, chest, stomach and belly. Obviously we're talking bowel cancer specific. So for your belly and stomach, you might get nauseous, you might be vomiting all the time, you could get constipation or diarrhea. Everyone's different, and throughout that 6 weeks for me personally, I didn't get nauseous, fortunately. But I didn't vomit either, but there was the occasional diarrhea because obviously you're getting this radiation blasted into your body and it's going to have an effect. Pelvis, so definitely in the bowel area, diarrhea, urination problems, and reproductive problems. Yes, it's very important. If you're going through any kind of therapy, talk to your medical team about your fertility concerns, because doing radiation in that area, it can affect the organs in the future. For some people, radiation therapy causes no side effects whatsoever. Some people might get 1 or 2 side effects. For other people, they might get everything. Everyone's different. But make sure as soon as you start to feel anything, talk to your medical team. There are solutions to help you.
What plan?
He's curing them.
Chemotherapy. Chemotherapy is often called chemo, and uses medication to destroy cancer cells. Chemotherapy is used sometimes on its own or in a combination with radiation and surgery, and sometimes the other options as well that we've already talked about. Quite often the doctor will recommend chemotherapy to shrink the tumor before surgery, so it is important that you have that conversation, and also after surgery to destroy any other cells that might be lurking around in the area. But also it can be used to improve symptoms. So depending on the situation, the size of your tumor might be causing some mobility issues and cause a lot of discomfort or pain. But it also may be used when there is no option for surgery as well. So it is important to talk about. There are many different kinds of chemotherapy medicines and treatment plans. I did chemotherapy 2 years ago, straight after radiation. I did that for 3 months. I did 6 fortnightly sessions. I was on a triple dose of chemotherapy. I would go into the hospital on the Wednesday morning. I'd be there for 8 hours. I'd leave at about 4 o'clock in the afternoon. They'd hook me up to a bottle to the portacath in my chest. And I'd have a bottle on me for about 72 hours. I'd go back on the Friday afternoon where they'd disconnect me, flush everything out. And then on the Saturday, I then have to do a steroid injection into my belly. So the kind of medication and how often they need it is different. Some people do weekly. I did fortnightly. Some people might do monthly. They might do every second month. It all depends on your individual situation. So it is important to remember that. As I mentioned, chemotherapy is given in multiple courses, which is called a cycle. So I was on a fortnightly cycle for a set period of time. I know a couple of guys in one of the bowel cancer groups on Facebook. He's done over 90 cycles of chemotherapy because surgery is not an option for him. So he just goes to hospital every fortnight, gets hooked up to the pump, and away he goes. Having a treatment in cycles allows time for the healthy cells in your body to recover between treatment. So, similar to radiation, the chemotherapy will kill the cancer cells, or do its best to kill the cancer cells, but it does kill surrounding tissues. Now, because with chemotherapy, like what I did, it's being infused into your body. So it will spread throughout your entire body, so your entire body will be affected by the chemotherapy. It is very important to remember that. So chemotherapy can be given in different ways. There is the oral chemotherapy, such as tablets. So when I did my radiation for those 6 weeks, apart from radiation by itself, I also had capecitabine, which is a type of chemo tablet. So I was having 7 tablets per day of the day of radiation, 4 in the morning, 3 at night. So that was, I think, 175 tablets roughly. I wrote it down somewhere. Yeah, 175 tablets total during that 6-week process, but I would only have the tablets on the day of radiation because they work together. There is the option for intravenous chemotherapy, so they'll inject it directly into your vein, over several hours while you're in hospital. They might use a catheter or a port, so I've got my chemo port just here. I've had that for 2 years, two and a bit years now, and I've still got more surgeries to go, so they're going to keep it in there. I get it flushed every 2 months, sorry. So it is important that you maintain that, because I will need that in the future. There is the option to inject it straight into the muscles, putting it into an artery that may supply blood to the cancer tumour, and also into the skin, usually in your thigh or your belly. Chemotherapy works by killing cells that are rapidly dividing, such as cancer cells, as I mentioned, and as well as killing the cancer cells that do divide quite quickly. They also kill off the normal cells, as I mentioned. But the important thing is that the normal cells repair a lot quicker than what the cancer cells do. So you might feel very sick for a few days when you do those initial treatments, but as that cycle goes on, a few days before you start your next cycle, you normally feel quite good. The main areas of the body that are affected by chemotherapy medication are the mouth, stomach, your bowel, your skin, your reproductive organs again, so it can affect your fertility ability, hair and bone marrow. It's really important the side effects all depend on what kind of medication is being used. So for me, I did a triple dose of chemotherapy, so that's 3 different medications. I did the Folfox, I did the Oxyplatin, and I always forget what the third one is. I can never remember. I can't even pronounce it. That's how long it is. But I had quite a few side effects. Dry mouth. My teeth changed color for a little while. My nails went a bit funny, and pretty bad diarrhea. On the Thursday morning.
It was all yellow.
I was okay on the Wednesday in hospital, but that next morning, it was pretty full on. Some people experience symptoms, side effects, some people don't. Everyone is different. If you do start to feel those side effects, please talk to your doctors. And your chemo nurses. When you're doing chemo, there's a whole team of nurses in there. If you have any questions, they're full of information. They're always happy to answer questions you might have. Some of the other side effects include fatigue and tiredness. So again, same as radiation. I got very tired. I'd sleep quite a lot during those 3 months because it is quite taxing on your body. Nausea, vomiting, loss of appetite. I didn't get nauseous. They gave me, I didn't take them, but I was offered anti-nausea medication every single fortnight. Didn't need it. I was very lucky. Loss of appetite, a little bit. So I eat a lot. I'm not a small guy, but definitely there was a little bit of loss of appetite there because your taste buds change that little bit. So food that you might normally enjoy will taste different and you're not going to want to eat it. Pain or soreness throughout your body, headaches as well. I got a few headaches, muscle pain or nerve pain, soreness in your throat or your mouth, changes to your skin, so similar to radiation. I got a few spots here and there on my arms and legs, so it is important that you are aware of what changes may happen. Diarrhea or constipation, I already mentioned that. And during chemotherapy, your immune system is weakened. So if one of your friends wants to come and visit but they're not feeling well, just tell them to hold off until they're feeling better, and then they can come and visit once they are 100% better. Okay, you don't want to get sick when you can avoid it. Sometimes there's weight gain or weight loss. For me, during this whole process of doing the radiation, the chemo, the surgery and everything else, I lost 40 kilos, as I mentioned in episode 1. I've regained about 30 kilos so far. The doctors don't want me to put any more on, so that's fine. But I went from being a decent size to 40 kilos down. As my doctor said to me, I was very lucky that I had the weight there to lose. Otherwise it might be a very different situation. Some more side effects. So hair loss. So I didn't lose my hair, but it did thin significantly. So I was very lucky. Some people go completely bald, some people go patchy. Mine was just a general thinning off the scalp. Changes to your concentration and memory. Some people refer to this as chemo brain. I definitely understand that because I could normally focus on a task quite easily. I would get distracted or I couldn't focus anymore. It still happens from time to time. So, the side effects of chemotherapy can be lifelong. Some people just have it during those during the treatment. Some people have it for a little bit longer. Some people have it forever. I still have occasional moments, so it's not very fun. Emotional changes. You know, you might be a happy, bubbly person, or you might all of a sudden become quite upset easily, or angry, or frustrated. You might not care anymore. All sorts of situations can happen. So it is important that, you know, you talk to your friends, talk to your family, talk to your doctor if you notice a change, or if someone notices a change in you, take it on board, and just listen to what's being said. Blood cell disorders, which may result in anemia, dizziness, shortness of breath. So I have low iron. I have my iron medication every single day. And, you know, it is really important that you are aware of this. You know, chemotherapy affected my veins. So it is quite difficult, you know, when I need to have a CT scan or any other kind of scan or a blood test when they have to access a vein. You know, it's just impossible, you know, and it's gotten to the point now where last week I had my first PET scan, and it took 5 technicians to find a vein. They had to get the doctor out with the ultrasound machine. I've still got a bruise 5 days later from that. So that was a pretty painful experience. So there are some side effects you don't think about. That's two years later. Yeah, it was not fun. Chemotherapy can affect your nervous system, such as tingling, burning, or muscle weakness. I still get the occasional tingling off my fingertips, especially when it's cold during winter, or if I'm getting ice cream from the freezer. You just got to be careful with how you do it, and be aware of this. Sometimes chemo can cause long-term effects, as I mentioned. Your treatment team can give you some more information about that. Late effects may be noticed months and months and months, or even several years after your treatment has finished. There might be organ damage, such as the heart, the kidney, the liver, lungs, or brain. Infertility issues, as I mentioned. So I've done radiation, I've done chemo. Both of these, infertility is a significant risk. I've doubled my risk by having to do both of those treatment plans, so who knows. There's also an increased risk of other cancers developing in the future. Now, anyone can develop cancer at any stage, but going through all these different treatments, because they do weaken the body, you are more susceptible, to develop cancer.
They're the cure-all that cures a lot.
So, the big one. So, surgery is usually, depending on the situation, the last option because it is the most invasive. Okay? I've had multiple surgeries. I know friends who have had multiple surgeries. I've got family who have had multiple surgeries. Going through a surgery is very traumatic. You know, you've got the preparation for the surgery, you've got your time in hospital, and then depending on how extensive that recovery is, you know, you might be out of action for a few weeks, a few months, a year, or longer. It's really, really important to understand that surgery is such an invasive process, depending on the situation. So, surgery is most commonly done with the intent to completely remove the tumour. The doctor goes in, they get the tumour, they send it off to pathology. Depending on what your pathology says on that tumour and the surrounding tissue, because they don't just take the tumour out, they take out the surrounding tissue, which is what they call margins, and that is also tested by the pathology department, because the doctor needs to know that they got the whole tumour out and if there's any surrounding tissue affected. Okay, apart from taking out the tumour and the surrounding tissue, they will also remove lymph nodes. Now, when I had my tumour removed almost 2 years ago now, the doctors removed 14 lymph nodes that all got sent off to pathology. And fortunately for me, all 14 lymph nodes were clear. Now, I still need to have more surgery because of my stoma situation, which we've talked about before and we'll talk about in a couple more episodes. But after I finish all my surgeries, I will still need to do at least 3 more months of chemo because even though those 14 lymph nodes were all clear, which I'm very lucky, there still could be something hiding that doesn't show up in a scan, doesn't show up on the lymph nodes. So then there becomes a precautionary treatment to ensure that my body is as safe as possible. Okay. So depending on the situation, an entire organ may be removed because of the tumor. So my tumor, fortunately, was quite intact. As I mentioned in episode 1, it was pushing up against the lining of my bowel.
Just repair the bowel and...
There are people who have had their entire large bowel removed, which is why we have stomas, which I'll get to soon. Polyps and in-situ cancers can often be removed during a colonoscopy, so we talked about that during the screening video. Episode, and if examination of the tissue removed, so the margins, under the through pathology shows that the cancer has not spread through the lining of the bowel, normally no further treatment is needed. Okay, now my tumor was found during my first colonoscopy. 2 polyps were removed at the time, but because of the location and the size of my tumor, I had to do radiation, I had to do chemotherapy to shrink the tumor down. So as I've mentioned, the tumor shrunk to almost half its original size. So the radiation and chemo did its job to make surgery as easy as possible for my doctors. Okay, so it's very important that you do look at those options. Okay, surgery for stage 1, 2, or 3. Bowel cancer may involve removing the cancer, so the tumor, okay, and the nearby tissues, as I said. Okay, the type of surgery is called a colectomy or a bowel resection if they need to remove a section of the bowel. Okay, so it's really important. Sometimes a tumor can come out without removing part of the bowel, but if the doctor has to remove a section of your bowel, it's not the end of the world. Okay, when I had my initial surgery on, when was it, November 2022, so almost 2 years, my surgeon was able to remove the tumor from my bowel and a section of my bowel as well. Okay, and they gave me an ileostomy as stoma. Okay, that was the purpose of that, was to ensure that my body had time to heal further down the track, and then they could do hopefully a reversal, but that didn't happen, which we'll get into soon. Okay, if the 2 ends of the bowel cannot be joined, a stoma will be made, as I mentioned. A stoma is an opening to the outside of the body, and a special bag called an ostomy bag is attached to the stoma to allow waste to leave the body, so your fecal matter. This type of surgery is called a resection with colostomy or ileostomy. So ileostomy is on the right most of the time, colostomy is on the left most of the time. Sometimes people's insides are a bit back to front, depends on how they are. A colostomy or ileostomy may be temporary or permanent, as I mentioned. So the long-term plan is to reverse my ileostomy, but the colostomy will be permanent and I'll have that forever. So yeah, during any of these surgeries, some nearby lymph nodes, as I mentioned, will be removed to check whether the cancer has spread, so it goes off to pathology. If the bowel cancer has spread to other parts of the body, surgery might be used to remove these spots if there are only a few of them. It depends. So if there's a few spots here and there, they'll go in, it's a small surgery, it's easy to look after. If there's a lot of spots, or if they're quite large, it can involve major surgery where you might have other organs removed, depending on the situation. Okay, minimally invasive surgery, often called keyhole surgery, is commonly used to help to make a diagnosis to determine the spread of what may have happened. That is called a laparoscopy, where they cut a few holes here and there, and they'll put a camera in to have a look around. That will give them an idea of whether they need to split you open in the middle or not. Okay, my very first resection, so the one in November 2022, that was done via laparoscopic procedure. Yep. They had 4 holes where they could go in, do what they had to do, create the stoma, and they were done. But in the January of 2023, that was an emergency surgery. There was no time to be fancy. They just cut me open, got in, did what they had to do. So I've got a scar that runs from about here to here. You know, that's fine. Okay, they put you to sleep. They do what they got to do. Yeah, you're in recovery for a little while. For me, following that emergency surgery, I was in hospital for 73 days, as we talked about. But there were a lot of complications on the way, and my body was not cooperating. I was just being a bit difficult. Okay. Recovery time from surgery varies from person to person, and obviously depending on the extent of surgery. So it is important that you follow the instructions from your surgeon, your doctors, your nurses, your physio, and any other rehab provider that helps you. Do your exercises at the hospital, do your exercises at home, do what you got to do to get as well as you possibly can. Okay. It does take time to get back to normal activities. Yeah, sometimes you might be able to do things after a couple of months. It might be a year, it might be 2 or 3 years. Some things you may not be able to go back to doing. So you got to be very careful. Okay. People who are diagnosed with stage 4 bowel cancer, where the cancer has spread to other organs, which is usually the liver or the lungs, can have surgery to remove the primary bowel cancer usually, and the secondary cancer as well, depending on the situation and how far it has spread. Surgery is unlikely to cure these advanced cancers, but they may help the patient to live longer. Okay, so it's all about longevity and making sure that you have the best possible outcome. Okay, if surgery is not possible for stage 4 bowel cancer patients, chemotherapy and or radiotherapy may be used in conjunction with each other to help shrink the tumor, to give the best quality of life possible, to help to slow the growth of the tumor, but also to deal with pain or mobility issues, as I mentioned previously. After any treatment, you might need some regular physical examinations, so you go see your GP, your surgeon, your nurse, whoever it might be, and you might do some blood tests as well, because there's what's called a CEA marker for your cancer cells, so that will help the doctor. It doesn't prove everything, there will be other exams to do, but the blood test does help with that. Okay, I have blood tests every second month at the moment. I see my oncologist every 6 months, I see my surgeon every 6 months, but they alternate, so I'm seeing someone every 3 months, so I'm not going through a huge break. I also do CT scans, MRI, ultrasounds, the whole lot. Alright, so recurrence and secondary cancers. Bowel cancer may recur after treatment, so it comes back. Okay?
He's back.
The cancer can recur in the bowel or somewhere else in the body, and is classified as being either local or distant depending on where it's located from the original cancer cells. Okay? Secondary cancer is when cancer spreads to another part of the body. Secondary cancers from the bowel usually develop in the liver or the lungs, because they are quite close, obviously, to that area. Treatment for the recurrence of bowel cancer can include one or more treatment options that we've gone through. So all the different treatment options are available. It just depends on the situation and how they go. Okay. If the cancer does not respond to treatment, then supportive care and or palliative care can help manage the symptoms and improve patient quality of life for as long as possible. So in the unfortunate situation that your cancer cannot be treated at all, if surgery is not an option at all, there are pain medications to help alleviate the pain. Some people do need to move from home into a special facility. Some of those are in hospitals, some are standalone facilities, where their family can come and visit them. They've got 24-hour nursing to make things easier. So it is very important that if you're in that unfortunate situation, you talk to your medical team. They'll give you the best advice possible.
What have you been doing, Robert?
As I went through in episode 1, I've gone through several different treatment options. I've done the chemotherapy, I've done the radiation, I've had multiple surgeries, both involving major bowel resections, ileostomy surgery 1, colostomy surgery 2. I've still got quite a while to go. The whole treatment process, as I said, I've lost 40 kilos, I've put on 30 kilos so far. My doctors are very happy that I've put that weight back on, because we know that I might lose more weight down the track when other treatments start, because I'm kind of right now I'm in the middle of treatment, or in between treatments, sorry. So it is important for me to be as careful as I can with what I'm doing, because I know that there will be more things in the future. Okay, I still have 2 or 3 more surgeries to go. I need to have the ileostomy reversed. I've got the perianal abscess that's still causing a few problems, so they want to have a look at that in the future. Once we do that, I do my 3 more months of chemotherapy. After I finish the chemotherapy, once the doctor's happy with that, then I've got to have surgery to remove the chemo pores, because hopefully, if everything goes according to plan, I won't need more chemo, and that's obviously the long-term goal. And obviously no more cancer, hopefully, that's the plan. Please join me next time where we discuss what support is available to bowel cancer patients and their families. All info discussed in today's episode has been sourced from Bowel Cancer Australia, Cancer Australia and Cancer Council Australia. Please like, subscribe, give me some comments, give me some feedback. There's a bell icon, I always point to it, so hopefully you're getting that notification. But thank you for watching. Please share this with your family, your friends, anyone who you think might need to see it, because I do get a lot of good feedback. I get a lot of messages from this, and please speak to a doctor. I'm not a medical professional. Talk to your doctor, talk to your nurse. If you have a friend who's a nurse, they might be able to give you some advice, but they will always tell you go and see a doctor. Thank you very much. Have a great day.